Did you know that approximately every 9 minutes a patient dies from a type of blood cancer? Rare medical disorders are big problems that need to be taken care of. To prove that this is a problem, I will be using pictures, interviews, arguments, and counterclaims. Leukemia is a disease in which the bone marrow and other organs that form blood produce abnormal numbers of leukocytes. These suppress the forming of normal blood cells, which can lead to multiple different symptoms. Just some of these symptoms are pain in joints or bones, dizziness, fatigue, fever, loss of appetite, weakness, and unintentional weight loss. My three main arguments are financial disadvantages, the environment, and the death rate of people suffering with leukemia. Financial disadvantages are just one of the many struggles of putting up with leukemia. It costs a lot of money to have different treatments performed in order to attempt to get rid of leukemia. One thing that can be done to try and stop this is a bone marrow transplant. Bone marrow transplants are very expensive, and there are two different types of bone marrow transplants you can get. The first one you can get is called an autologous bone marrow, which costs around $375,000. And the second type of transplant you can get is called an allogeneic bone marrow, and this one costs about $925,000. This is a lot of money for somebody who already pays for other pills and vaccines to be used. Each bottle of pills or vaccine taken can cost up to $100 alone, and we cannot forget about chemotherapy and radiation, which can cost up to $500,000. Financial disadvantages are not the only problem, however. Environment can also be a problem. The environment in which we live in can also be one cause of leukemia. The cause of childhood leukemia is unknown. However, scientists believe that the cause of leukemia in adults could be because of the environment. There are toxins in the air and ground, and when exposed to them too long, there is a chance that leukemia can form in a person. Lastly is the death rate of people with leukemia. Death rates are very high, which is why scientists need to find a cure. Although almost 61% of people with leukemia survived, there are many people who didn't survive. It is estimated that this year alone, 20,110 people of all sorts of different ages will be diagnosed with leukemia. Out of that 20,110 people, 4,660 deaths will most likely occur. This may seem like a good thing that only 4,660 people die, but what about their loved ones or people they were close to? Those people could never be the same because of this problem. Not only are patients affected, but friends and family are too. The next topic being discussed is the interview. For the interview, I have decided to interview somebody my mom knew. Her name is Jamie. She went to my mother's high school, which is abandoned. It is now abandoned because the junior high and the high school were built near a place with toxic waste. This got into the ground and then the groundwater. The school used the groundwater for drinking fountains and such, and then kids started coming up with different symptoms, later found. How do you relate to the topic of rare medical disorders, more specifically leukemia?
I was diagnosed in April when I was 23, and then I had a bone marrow transplant in January of 97. And that was all done at Johns Hopkins in Baltimore. So yeah, that's me with my leukemia. Because of the different types of leukemia, there's different treatment plans. For my treatment, it was going through chemotherapy, radiation, and then having the bone marrow transplant. When I was diagnosed in April and May, my leukemia accelerated. So I was admitted to Riverside Hospital for about 3 months. I was given 9 doses of chemo in 6 days. And then, so with that, of course, I lost my hair. About a month of it, I don't remember, just because I was so medicated due to pain and different things, that there's about a month of my life that I basically slept through, I guess you could say, due to medications. And then after the 3 months, again, I had to learn how to walk again because I was in bed for 3 months. Then that January is when I went back for the transplant, and then again I had to go through chemo. At that point, then my hair started growing back, but then I'd go through chemo again, so I lost my hair again. And then went through radiation, so I had to go into the hospital every day, get blood work done, see if I needed any type of transfusions. Some days I needed blood transfusions. Some days I needed platelets because my platelets were so low. During my treatment, I honestly couldn't tell you how many medications I was on because we had them sprawled across the counter. So I would say probably at one point I was probably on at least, I would say 15 to 20 medications for the anti-rejection so that my body would accept my donor cells and different things like that.
There are many organizations to attempt to find a cure for leukemia or try to make the patients diagnosed with leukemia feel better. Make-A-Wish Foundation is one of these organizations. Make-A-Wish Foundation is a foundation that gives many kids one wish that they have had, so they can have fun even though they are going through this. On average, Make-A-Wish Foundation grants a child's wish every 34 minutes. These patients can go to Walt Disney World, the circus, meet celebrities, and so much more. One child named Alexander was 9 years old with acute lymphoblastic leukemia. His wish was to go bug hunting. Make-A-Wish Foundation granted his wish and took him to a place where he could catch many different bugs. Some people may say leukemia rates have gone down over the years thanks to all of the treatment plans. And yes, this is true, but many are still suffering with this disease and their ages vary. Children, adults, even animals can have leukemia. Also, leukemia is not the only rare medical disorder. The main social issue is rare medical disorders, and leukemia is only one of them. There are many others that have different disorders that cannot be cured or do not even have treatments. Again, leukemia and other rare medical disorders make a big change in somebody's life. They may not have the type of income to take care of the problem. There's so much they are going through, and scientists need money in order to stop this problem and find a cure.